Good afternoon to everyone present here. I cordially welcome you all to TechBharat 2021, Empowering EduTech and HealthTech. TechBharat is an initiative of Laghu Udyog Bharati, Karnataka, and IMS Foundation. TechBharat is envisioned as a platform to support startups and SMEs and be a guiding light to them in navigating their entrepreneurial journey. We welcome you to this session on support to startups in healthcare technology. Healthcare in India needs to become innovative and affordable. Challenges like accessibility and affordability continue to pose questions. Healthcare entrepreneurs are increasingly coming out with innovative and path-breaking solutions to enhance healthcare. Through social entrepreneurship, access and traction to healthcare insurance, financing of healthcare services, building healthcare repositories, and adoption of innovative business models to tackle healthcare needs is essential. To discuss this further, we have an eminent panel with us today. Firstly, I would like to welcome Dr. Lakshmi Jagannathan, CEO of Dalbai Foundation, and thank her for accepting to moderate this session. She plays a strategic role in driving the innovation and entrepreneurship ecosystem at DSI. She is a principal investigator for funded projects for more than rupees 10 crores funded by the Government of India and the Government of Karnataka. She has established and managed Dalbai Foundation, a Section 8 company, which is a technology business incubator supported by Government of India. A startup evangelist and a passionate mentor who is very well networked with all key players of the startup ecosystem. A firm believer who is relentlessly pursuing to transform campuses into platforms of innovation and entrepreneurship. Dalbai Foundation's vision is to create a sustainable ecosystem for entrepreneurship through the state-of-art technology and business wisdom. I cordially welcome you to this session, madam.
Thank you, Vishnu. Thank you.
We have Mr. Pankaj Thakur, CEO of Paddock Ventures, with us today. Pankaj is a tech evangelist with specialization in digital media strategies, digital marketing, online consumer behavior, and big data applications. In his various C-level roles and as the founder of multiple startups globally, he has built and advised and transformed both corporate and startup companies to become highly successful. He is the CEO and co-founder of Paddock Ventures. Paddock Ventures program to validate, incubate, and accelerate enables entrepreneurs to transform through a deep, well-designed, and structured education. Their core purpose is to participate in nation building, creating employers, not employees, and driving the entrepreneur spirit of India. We thank you for accepting our invitation and welcome you to this session, sir.
Thank you so much for inviting me.
We have Dr. C.M. Patil, CEO of Krishi Kalpa, with us today. C.M. Patil is an engineering graduate and brings a decade and a half of entrepreneurial experience and has held positions like director, CEO, national technical head in his professional career. He was on the board member for 6+ years of a company which grew from 12 people to 350+ team, rendering their services for Fortune 500 companies. He was then regarded as the youngest corporate trainer certified for a few major MNCs. As CEO of Deshpande Startups of Deshpande Foundation, he envisioned to create a hub for mission-driven entrepreneurs in the region. Presently, he is the CEO of Krishi Kalpa. Krishi Kalpa is built for collaborating between the society, government, and private sectors, dedicated for uplifting livelihoods of farmers. Its vision is to increase their annual income, make them adopt best practices, get them deeply involved in digital revolution, eventually making them agripreneurs. We are excited to have you with us today, sir.
Thank you, Vishnu.
We have Dr. Bharti S. Meti, Professor and HOD of Department of Biotechnology at Basaveshwara Engineering College, Bagalkot, and Executive Director of BEC STEP. BEC STEP was established in 1999-2000, and the thrust areas include food, bioenergy, textile, biotechnology. They provide infrastructure, co-working place, and mentorship, along with access to food processing and food testing labs. We welcome you to this session now.
Thank you.
We also have Mr. Rajaguru, founder and director of Astromeda Space Private Limited. Rajaguru Nathan has over 10 years of research and entrepreneurship experience in the field of aerospace engineering. Astromeda is the first Indian space and medical robotics company which develops microgravity research and automatic drug dispensing system for mid-sized hospitals. I welcome you to this session, Mr. Rajguru.
Thanks, Vishnu.
I now request Dr. Lakshmi Jagannathan to take over the session and moderate it. Over to you, madam.
Thank you, Vishnu. Good afternoon, all my fellow panelists. I think probably I would, one big challenge is moderating a panel like this is all veterans, there's so much of pressure. I would ease down the pressure on myself, probably few opening remarks and setting the context. Then I think we would take it forward. I run an incubation program, as Vishnu was telling, out of Dayanand Sagar, Bangalore, called Derby Foundation. Last 2-3 years plus, we've been focusing on healthcare startups. So one of the biggest challenge we have been seeing with the healthcare startups is, of course, there are a lot of innovations happening. A lot of startups also working on solutions on healthcare. But then taking it to the next level, there are huge challenges. And I think COVID has really opened up the scenario, where there's a real need how technology can be interfaced with whatever we are doing to solve problems big way. I think this panel probably we would have to discuss in two parts. One is the opportunities which are there for innovations in healthcare and how it can be deployed specifically in the Indian scenario, and the bigger context of what are the challenges to deploy healthcare solutions, especially healthcare tech solutions. Because the challenges are phenomenal. We've been working with starting from, I think everything starts well as long as ideas conceptualized in their minds. Moment they start building, starting from building to implementing to regulatory to market to commercialization, problems are phenomenal. It's huge. So I think somewhere we'll also have to touch upon all these, after the opening remarks, probably I'll pick up the threads from your conversation. It'll be good if we could weave something together as a takeaway at the end of the conversation, right? Now, having said that, probably we would start with all of your opening remarks. I would now like to request Mr. Pankaj Thakur, because I think let us start with funds first, because for entrepreneurs, money is always music. So we'll start from where the funds come, and we would like to give your opening remarks, Pankaj, about what has been the scenario specifically on healthcare. You have been investing in a lot of startups, in terms of both opportunities and challenges. Probably few opening remarks, and we'll take it forward.
Thank you, Lakshmi. Thanks for giving me the opportunity to speak first. So yes, you're right. And when 5 years ago we decided we're not going to do another startup and help startups, we realized the biggest challenge is when anybody walks through the door, he's first looking for funding, then maybe he's looking for some business, and mentorship is something that he doesn't value at all. And it was a tough job for us to actually convince him that if you have mentors, then you can actually, those mentors can help you get some business. And if there is a business, the investors will come running around. Investment is a pull event rather than people making it a push event. And the problem with that is that the fundamentals of entrepreneurship are not really understood by the entrepreneurs in this country. And I also did not when I started 22 years ago. I just went around, the VC community was a new thing. We all chased them. We had friends who were actually becoming VCs. And we realized that that's not the right one. We just need to build a business first, and then we'll see where the money is coming from. So the investment community in India is very vibrant. There's lots and lots of money. And fortunately, for the last 10 years have been good for startups because we have seen a lot of unicorns and a lot of money has gone in. A lot of angel investors have actually multiplied their money 10x, 100x, 300x. I mean, Oyo was a good example where a good friend of mine had 187x. I mean, what more do you need in a life? One lifetime is good enough to do that. But when you go out there and actually talk to the investors, a couple of things comes out. One is the investors are looking for solid evidence whether this business has any sustainability first and then scalability. Evidence, as they call it, and it's a real evidence. And that evidence comes from actually interacting with the stakeholders on the ground. And the primary stakeholder there is potential customers. In healthcare, that is missing like nobody's business. I have been on many BIRAC review committees, and have seen many fantastic startups who got 50, 60, 70, 80 lakhs worth of grants. Product is good, but nowhere to go. I'll give you a case in point. We had one very good startup out of Bangalore called Ameliorate, husband-wife team, both of them PhDs and beyond that. They created a product where with one drop of blood, you could actually figure out whether you got malaria, chikungunya, or dengue in less than 10 seconds. When they came to us in a program, so we do this mentor-driven program. So when they came to us, in about 3.5 months' time, we showed them what is the market. They were themselves surprised this is the market. They were chasing pathological labs. They were chasing government institutions, and they were going nowhere. Moment they came to us, we first said, okay, let's change the whole this thing. Let's find out who's the customer, and you will be surprised. Their first customers were actually general physicians, and general physicians were so excited about the product they wanted to place orders while these guys were actually doing the primary market research. Next happens, they went through the program. Right now they just have a prototype, right? They just have actually got uh, the patent and everything. We raised 2.5 crores for them. For what? For clinical trials. First time in the history of any medical this thing that investors actually put money for do clinical trial. And the reason was there is a solid evidence that if this product goes to the market, there is a tremendous amount of appetite for market to actually, there are customers who are willing and able to pay. So funds is not an issue.
Sure.
How you approach the funds and what are you going them with, and that's the entire progression that you need to follow to create an evidence and a compelling story for the investor. End of the day, when I did my startup in Silicon Valley, one of my mentors told me, go and read a book called How to Write a Film Script. Because if you can write a good script which people can believe, people will pay you. That's what all film build business is. And here we are talking about solving real problems and building a script on that. So they need a compelling evidence and a story, and money is available for any kind of startups. I hope.
Yeah, sure. I think next we will move over to Patil. You know, Patil has been, I would say, iconic with the Deshpande Foundation. A totally different scenario. You know, typically done a lot of work with non-metros, rural entrepreneurs. Overall, on the healthcare scenario, but we just wanted to understand in the non-metro rural scenario, what has been your experience working with DF and with Hubli and generally non-metro scenarios?
I think, first of all, thanks a lot for the Tech Bharat team for having me on the panel. Really appreciate their concerns towards the society and then having this panel going on, pulling such eminent panelists. Lakshmi, to just a point of view, I think healthcare is more a non-metro market, I would say, because India is a country of 1.3 billion population. And if you look at the metro population, is hardly about 203 million across the country. And more than 1.1 billion people lives in non-metros. So one of the thing what an entrepreneurs working in this sector need to understand is the psyche, the mindset of the people whom they are actually catering with. And healthcare and agri-tech are the two caters where they need not chase a market abroad. That's India is a big gold mine for them. And COVID has exposed everybody of us. I mean, thankfully we managed it so well that many of the multi-developed countries are struggling. So which says that now the technology is relevant. When I say infrastructure is ready, more from connectivity, we have people, we have doctors, we've got telemedicine. Some of these things are so ripened. The timing is so perfect. And I remember Dr. Kiran Mujumdar in one of my panel telling that healthcare people, up time hamari bari hai. So that makes a very big statement for somebody coming from that sort of person, which says that the opportunity is what we have got. As I said, it could be in the telemedicine, it could be in the remote monitoring, it could be in the ones what Pankaj mentioned, the diagnosis center, because today everybody can't go it. And I remember this applies for education, but we can actually might as well apply for healthcare as well. If a person can't come to hospital, can a hospital go to a person? The meaning what we said in education at one point in time was that if education can't come to school, when kids can't come to school for education, can the school go to the kids? So we can actually apply this is the right time for us for healthcare sector to be revolutionized in the country, and there is no difference. So evident I could say when I was in Hubli very recently, where a lot of these structures, there are multiple companies who are wanting to do a trials there, and it could be as I said, in telemedicine, it could be even in product space there. And I see a lot of youngsters taking up this particular sector very actively. And if one does right set of customer discovery, I think the next billionaires unicorns come from this particular sector. So that's my take on that, Lakshmi.
Sure. Yeah. Thank you, Patil. I think we'll move on to Dr. Bharti. Bharti is working in hardcore biotechnology, right? I mean, so I think again with the Covaxin and the vaccines, biotechnology is in the spotlight now. So how do you perceive, but again, there are a lot of opportunities, but challenges with the longer gestation and all that. So what has been your experience with biotech startups and your opening remarks on that?
Thanks for an opportunity for me to express my views towards this healthcare startups. And since I'm in the biotechnology, but it's a very good chance for us. What I can say is biotechnology now automatically the COVID has made it advertisement, we can say it, because a lot of people understand the role of biotechnologist during this COVID situation. And especially the healthcare industry in India is upcoming area, and a lot of innovation should happen in India. And especially it is like as we see the statistics, there are few healthcare industries in India, and India is also projected to reach $372 billion by 2022. So this is the target in front of the biotechnology and allied people. Healthcare is like one of the most promising sector to invest in India, what I can say. And being the second largest population of the world, India has ever rising demand of good healthcare and world-class facilities. It is never ending, and India needs this. Especially the health tech sector is currently one of the most dynamic in technology, as aging populations, increasing patient demands, and the rise of lifestyle diseases, and coupled with the pressure on the costs for delivering care for forcing healthcare providers to innovate, to improve the quality of their services and lower their prices. So it is a challenge for all the healthcare startups or innovations in the healthcare is the economics and affordability. It should reach to the common person. That should be the one criteria while we go for innovations. There are many, like with global companies focusing on research, especially the pertaining to drugs, vaccines, diagnostics, what we can see here. But there is a growing requirement for skilled medical researchers or also with the companies developing biotech products, and large pharmaceutical firms with research facilities is the requirement. There are also many research organizations and industries where highly complicated research work is being conducted. But the Indian government, what they are supporting for all this startup is the scope for all the startup companies. And here we have to concentrate on the using the latest technologies or robust technologies to come out with the solutions for this healthcare sector. This is from my side, ma'am.
Sure. Yeah. Thank you so much, Dr. Bharti. Now, having said that, having heard all four of us, I think it's very important to hear from the horse's mouth. Rajguru, we would like to hear from you as a healthcare entrepreneur. What would be your perspective of the opportunities and the challenges in the ecosystem at large?
Yeah, thanks for the opportunity for the given by the TechBharat, and thank you, Lakshmi ma'am, for moderating the session. So it's very great to hear from all the different sides of health tech challenges, and I would be happy to share what challenges we face as a startup actually. Yeah, I've been in this startup for the last 6-7 years. We were working on different projects on this startup. So basically, I'm a non-health tech person working on a health tech startup. So I'm an aerospace engineer, and I came as an one of my co-founder is a doctor. So we joined together to launch our startup called Astromeda Space Private Limited actually. So basically, we are working on creating robotic systems for the startups, for medical robotic systems for the healthcare segment. That's what we started working on actually. So all the health inputs is given by the co-founder, the other co-founder who is a physician, who is having 20+ years of experience. And we started moderating the product based on his requirements, and we are taking it to the market. So the path is not as easy as we were thinking. Like when we make a product and when we make a product as per the need of the people, it's not directly readily taken by the people actually. So one of the major challenge we face is like educating the doctors to use the product. Basically, we were working on, first we started working on with the automatic dispensing systems actually. So these automatic dispensing systems, it's completely available in other countries, which is era of like digitalizing the healthcare segment actually. So one of the major challenge we face is like to first introduce the product and then size the product based on our client requirement actually. So first, as a tech entrepreneurs, we are like ignoring the requirements of a customer, and we are taking the complete technological advancement what we can give into a product. So that is the major challenge or major issue we face as a tech entrepreneur. So we have to understand our customer requirement first, and based on the customer requirement, we need to size our product. So that is the major challenge we faced in the first like introduction of our first product to the market. Next, in the next stage, educating a product to a customer. Like when a new product, healthcare is like a kind of a very before taking the product, they need a lot of trials to be conducted, and if the trials are proven, then only they'll take the products to the market. So there also we face the next set of challenges. And the third one, when it comes to the investment, as you rightly said, now I believe like almost all the entrepreneurs, we understand that money is like secondary. First, we want a tech mentorship, which will definitely help us to take to the next level, especially the field expert. So being a non-health tech entrepreneur, if given the good health mentorship, then it will take us easy. It's easy for us to take our product to the segment than before. So we all, as an entrepreneur, we believe that mentorship is more valued than any of these like money or investment. That's all secondary. When we have a right product, when we have a right mentorship, then it's easy for us to take our product to the right customers with their understanding their right requirement. Then automatically, when the traction starts, then we are ready for the investments.
Yeah, thank you. Now I saw that smile on Pankaj's face, exactly contradicting. I mean, he said startups about mentorship. What comment he made earlier? Good that you're agreeing on that. Now I would probably start with Patil. Patil made a very interesting observation that healthcare is a non-metro problem. Right. Having said that, it's in India, healthcare is a non-metro problem. But all the resources, be it access to hospitals, mentors, investment facilities, everything is there in the metro. So how do you bridge the gap?
Okay, so I think that's an interesting observation also, Lakshmi, because all the the phenomenal facilities are there now here. That's where I see an opportunity. I think for me, let me state why I said what I said.
Yeah.
I see there are three kind of people in the world. One of the problem are the people who see the problem, they don't care about it. They just are ignorant about it. So that's one category, you just keep it aside. Second are the one who sees a problem and sees somebody else to solve it.
Okay.
They expect government to solve it. They expect some university to come in. And the third category, whom I call entrepreneurial category, they see problem as an opportunity. Now, when I said the opportunity that the 1.1 billion people are not having access for going for the world-class healthcare facility, it should actually be a music for an entrepreneur to look at it. How do we capture the market? And that's a big market. I'm not trying to glamify or glorify the non-metro cities. That they are the real people. Now with the advancement of the technology which are there, take an example of telehealth. Why would somebody have to travel from all the way from remotest corner of the city to Bangalore? If I have to talk about Karnataka, why can't now this COVID has opened up so much on the medical health or the telehealth? Why can't the consultation be done on the remote passes? Not many a times. See today the biggest problem is the diagnosis. The diagnosis for us to happen, we have to all the way visit and we keep on following it up. Can we do a innovation on that front? And rightly, as Pankaj rightly said, and even I'm glad Rajguru also agreed that mentorship matters a lot. If any entrepreneur discovers this problem and identifies that there is a gap, and if he or she can make a small POC and prove it's been working it out, probably if it has Practo would have started now, they would have got really different age, because when they started way back early, I'm sure they are even doing fantastic even now, but the timing is right for it is what I feel. And not only from a telehealth perspective but also from the product perspective, I had one particular company by name Just Hearing. It's called now Just Hearing, the product name. Nautilus was this product. They were actually building a product, a low cost product with ultra modern facilities. How do I diagnose my hearing aid problem? So typically, let me take an example. Anybody who visits the audiologist, they end up spending about 500 to 600 rupees on an average. I'm telling the minimum average in the metro cities. Now, this guy has devised a patented product which can actually works like a small headphones put onto the person, and there you need not create the entire audiology room. Look at the way how 4 years back he's been slogging his walls to get the things going on, but now is the right time. He struggled big time to sell it in non-metros, but in metro, when he came down within a month's time, he was able to get 5 big orders at one shot, and less than a week where he was able to get it. So I think where they are missing is, I believe that there are 3 M's which are required for any entrepreneur to go to the next stage. One is get a right mentor and get the market access. The money will always follow. If these two, market access is the key. And now when our market is so wide and so virgin market available over there, there are going to be ups and downs. It's not going to be, entrepreneurship journey has never been easy. It's always like a sinusoidal wave. At morning you are at the peak, and evening you say, why the hell we started this? If at all we are willing to take up that journey, I think that opportunity opens up thousands of doors for these people from various points of it. Ambulance services, nobody gets it in non-metro cities. You won't get a hospital bed. Can I see a hospital bed availability there? I can't get it. So I that's the reason why I believe that this is an opportunity of non-metro market. And if entrepreneurs are not looking at that segment, nothing like it. I can go on talking on products. I'd seen one other product which can actually, by holding the nadi, they can tell what of it. Now Nadi Shastra has gone big time, but there is one entrepreneur from Pune who has digitized this, can give some 72 parameters of the healthcare perspective. Now this, he's again trying and going and chasing the wrong market. But if they actually have that ability, because now the entire ecosystems are coming up together. I'm sure Bharti is there from Bagalkot, you are there from the part, and even Deshpande startups at Hubli. All of these ecosystems are conducive for this environment, and that is one of the reasons why I feel the timing is right for us to capitalize on that part.
Sure.
I hope I did answer why I said why.
Sure. Actually, I have a leading question to Bharti from that. See, I mean, I think Patil very well mapped about what are the opportunities for entrepreneurs on healthcare in non-metros, right? But Bharti, you must be also having a lot of entrepreneurs from places like Bagalkot who start off, right? What are their typical struggles? Because definitely entrepreneurs are from a non-metro, opportunities are also from non-metro. So what are the typical struggles they go through? Because he painted a picture where there was an entrepreneur from a non-metro, got opportunities in the metros and then scaled up. But if your entrepreneur starts from Bagalkot, has an opportunity in Bagalkot, but no support ecosystem, what does he do?
Yes, madam. Yeah, truly. What CM Patil sir truly said that non-metro cities, the innovators or the entrepreneurs are struggling. So according to my perception, like struggling in the sense they have a lot of zeal. So they wish to come up and they want to be a successful entrepreneur. But what the exposure and the mentorship is the main problem what they are facing. The exposure, for example, I visited the Deshpande Foundation, that BBC Bangalore. So, but all these, they have some ecosystem. Plus, there are a lot of people all over India, all over world, they are come there, and like interactions will be there, and one-to-one they will learn. But cities like Bagalkot, I can say we have a very good infrastructure, we have a very good place, co-working place space, and all the basic amenities. It's a very good place, but we are not able to attract the good innovators here since the ecosystem possibility is not there, and that exposure they are missing it. And mentorship, of course, it is connecting the, especially the metro people are coming to the, especially madam, today I'm very happy that Lakshmi madam, so you have made it possible to attract or to drag us, especially I can say you drag us to this team and all. So that mentorship, now we can get it from a developed ecosystems. It's not the problem. Main thing is exposure. What I can say, exposure is not there, even though infrastructure is there, plus the well connectivity is not there.
So Lakshmi, if I just can add a point on that same, until very recently I was doing the same thing what Bharti was doing there. I always believe that most of the entrepreneurs come to are the breed of lions. All we have to give them is a taste of blood. and we should not give them the meat directly. You should actually give them the, I mean, Dr. Bharti, that helps you, right? Try and see if at all you can connect them to mentors who ask them right set of questions. The way how I did it, Deshpande Startups, was get a mentor, ask who is going to be a person who is not going to give a solution, but a person who is going to ask a meaningful questions, and get it such big that they will not get the question of the wisdom of the mentor. And once they start making peace with it, I think the magic happens. I'm sure Pankaj also had a point to throw on this point, and then this is how the entire revolutions in the entire ecosystem will start, is what I feel.
Yeah, exactly. My next question was to Pankaj. Pankaj,
Yes.
how do you make entrepreneurs taste blood?
So, very interesting discussion this is, and Dr. Bharti has pointed out a very important question. The connectivity, of course, that has to be the primary thing, and today everything being virtual, I think if you have a good internet connectivity, all your problems can be solved. That I can assure you in next, and I can help you, and anybody on this panel can help you. So my interaction with the rural entrepreneurs or the not so urban entrepreneurs started in Bhubaneswar. So I was a mentor with, I'm still a mentor with KIIT TBI in Bhubaneswar, which is a large biotech center with about 100 odd biotech startups there. And we took about, one cohort of about 15 of them, and we started working with them. And what I realized is that, yes, I think CM Patil is absolutely right that the real opportunity is in rural areas. However, from the business perspective, we have a concept called beachhead market. The beachhead market is always an urban area. Even if there are, so we had, in Odisha from inside, from Bhagalpur, from this, I don't know, I don't even know the names of the places. The entrepreneurs came from there. Unfortunately, these entrepreneurs were invited by Startup Odisha, and we did a program with them. And we realized that every problem that they were solving was actually real problem, and that problem is across the country. It is not for one Odisha, because we may have a lot of diversity in people, but we are so homogeneous in our habits, eating rice, right, eating fish, our agriculture. It's almost similar patterns all over the country. So if you're solving one problem in one small village in this thing, you do that. Now, how do you bring that out? So the one way to, Odisha has done fantastic, where this KIIT itself has about 25,000 students from the rural area studying free, from nursery to PhD. Now that's the ecosystem they have created. So that's where the interaction starts happening. To entrepreneurs to go down to the rural areas, I think that's happening now, primarily because of the government initiatives that the government is doing, and all these kendras that are coming up, and that is happening. Also because of the penetration of internet. So they have realized that there is a huge possibility in urban areas, but urban area is good test market for you to see that product works or not. But real market is in this thing. All the biotech companies that I have seen, their real market actually is in rural area, not in urban area. And they are now reaching out to them, and government is helping them. So we are not very too far off from seeing them in next couple of years that they will actually. Give you a small example. So we had this guy coming down from, he's a PhD student, came down, and he was actually working with fisheries. And he created, he said that the India production per pond, which is 1 hectare or 1.5 hectare pond, is 30% of the global average. And the only reason for that is the water of that pond does not have enough oxygen. Because it does not have enough oxygen, it does not have, and that oxygen, if the oxygen quantity is increased, and along with that, the feed is actually automated, the production will go up 4 times. And then for a primary market research, we sent him to the interiors. Guess what? There's a guy who had 3 ponds. He did not let him go back for 4 days. He hosted him, gave him food and everything else, and said, you tell me, when can I have this product in my this thing? And then we realized Odisha has something like about 30,000 ponds. All you need to do is, and he developed the AI, so technology. Now you bring in technology, he built up an AI-based system where that system will go into, it's a small motorboat kind of a thing. It would go into the pond. It'll actually induce oxygen, suck it from the air, put it into the pond, and balance it with the fish feed. So the feed has to be actually, and the business model, and that's where people like us can. The business model we said to them is, if we are able to do this, what is it that is in it for us? He said, my average income is 3 lakhs. With this, I believe it's going to go 9 lakhs. I'll give you 3 lakhs. From one pond, they were ready to give you 3 lakhs. We did not take that. We took only 30,000 rupees per pond. And he is now having a backlog of about 2 years. So you have to understand that entrepreneurs do not go to the rural areas because there is nobody to tell them where the market is. They're too fascinated by the urban markets. They're too fascinated by looking at what we do. And I'm not talking about one of them. There are at least 15 of them. They all went to rural areas and they're all working fine. Some of them got BIRAC grant. Some of them got follow-up grant. So they're all working. So I think we are not very far off from going there. They already tasted the blood. I can tell you that.
Yeah, I just want to add the entrepreneurship view to this actually.
Very sure.
There are two views. One is the metro entrepreneur going and expanding into a non-metro city, actually. So for a non-metro city, whenever, as an entrepreneur, we want to sell our product as much as possible to as much region as possible, so that we can create a good sales channel as well as we can increase our traction. So always we wanted to sell our products to the non-metro market as well. But as an entrepreneur, if you get into the non-metro channels, as you rightly said, it's not a readily available market. We need to they want check that where these products are already used, or where it is already how the product is responding to the existing markets. They're very conservative market actually. Once it is tested everywhere in metros and proven technologies are available, then we can go and educate a non-metro market. Where when it comes to a metro, at least here some tech saviors are there who really wanted to test the first come product. Okay, some technological advancements is coming. Okay, we are ready to test in our hospital. We are ready to test in our health centers. So there is a low-hanging opportunity in the metro market when compared with the non-metro market, which is a challenge. But if you see on the scaling side, all the scaling is possible only on the non-metro market when compared with the metro market. We have numbers of hospitals and health centers, and the people availability is more on a non-metro market when compared with the metro market. So as a metro entrepreneurs, we have a challenge of accessing a non-metro market and educating them and taking our product to that. On the other side, if I am a non-metro entrepreneur, so one of the main challenge I miss is ecosystem. I don't have a mentorship ecosystem. I have some of my friends who are from a remote village who are very technically expert, who has developed some products, but they are not having a right mentorship and right advisors to take their product to the metro market first, and then execute their business here and then take it to the non-metro market. So basically, as an innovator in a non-metro market, we have market acceptability is very less, and opportunity for mentorship and connectivity and networking is very less, which is also one of the major challenges we can face as a non-metro entrepreneurs. So that's where most of the incubators in the non-metro areas can help those entrepreneurs to help and take their product to the next level. So it's like both the areas we need to see and approach in a different way.
Completely agree with you, Raj.
Very well said, Rajguru. I think you
Completely agree with you. But I think the things are changing with the internet. I think the mentors. So this COVID has actually proved that you don't need to be physically everywhere to do everything. Everything is going online. So Dr. Bharti, if you face any issue with mentorship, please connect with me. We have a pool of 50 mentors. We can connect with you. We do all our programs online. All our programs are mentor driven. So Rajguru, yes, you were right till yesterday. Now the next thing you talked about the whole, the market. Remember the blue ocean philosophy is you have to find new markets.
Yes.
Death of large enterprises happens because they stay confined with their existing customers and they die because of that. So unless and until entrepreneurs go out and find new markets, which is the rural markets, they will not, there's sustainability and scalability. And yes, you rightly said the scalability, cross the chasm. If you stay connected in metro cities and only believe that people are looking for new products and they will test it, but they will not be able to scale it. So you have to cross the chasm with the majority of the people actually being in rural areas.
Yes.
Yeah. While I thank Pankaj for his optimism, no, I think initially, Pankaj, you also made a comment about evidence for investors. May not be investors, evidence for investors, evidence for future customers as well, right? So it's a big challenge in healthcare. Anybody who's building a healthcare solution, no, he will find it extremely difficult to deploy somewhere, do a pilot, get a feedback, change, do that. So how do you think the ecosystem or the incubators should be able to facilitate this? I think people are working in healthcare. Creating this evidence is a big challenge.
So, Dr. Lakshmi, the biggest problem is, entrepreneurship is about two things. One, you look at it either from the point of view of market pull or technology push. 99% of the entrepreneurs are looking at technology push. They go like a bull in a china shop and want to change the world. It doesn't happen that way. There's a process to it. I'll tell you, there was a startup here in, it is called Inoki Care. They won a lot of awards globally now. They came to us and they were creating the negative pressure wound healing system, which today cost about 5 lakhs plus in the healthcare system. And I have a lot of experience with healthcare, so I can talk about it.
Yeah.
And I talked to them, what are you doing? So they are saying that we are doing this, we are actually going to reduce the cost to 50,000 rupees. I said, is price is the only factor, that you don't need anything, you can create and do that. He said, no, sir, but we don't know who's going to buy it. Now we helped them go around and they found that everybody is ready to buy. But the first person who said who's ready to buy was a trauma center on the highway. And they suddenly realized that 40 trauma centers that they visited, all of them said, let me be your first customer. The problem with people is there is nothing, you have to get out of the building, you have to go out in the field, you have to do what we call primary market research. This is the fundamental for your business. Either you go home or you go big after that. But you need to go and connect with the stakeholders, go out there, and there are tools to do that. You need to learn those tools, you need to go out there. It's a 3 weeks exercise. That 3-week exercise will tell you whether you should spend your next 3 or 30 years there, or you should pack your bags and come back after 3 years. Because that's more important. You want to fail early. But don't be in this whole thing that, that IKEA effect. Because I have created this table, it is the best table. That's called IKEA bias. Neighbor has also done the same thing. But my table is better than him because I created it. It doesn't work that way. So the entrepreneurs have to unlearn a lot of things to learn a lot. They should focus on their core, learn from the mentors, and then move out into the market to see what's available, what can I do, can I change it really or not, or am I, in North there is a saying, Mungeri lal ke haseen sapne. You just daydream everything and then you think you're going to be a millionaire there.
Sure, okay. Bharti, you were earlier, in fact, among the initial support programs for early stage startups, I think BIRAC Big is a very, very successful program. Earlier you were mentioning about BIRAC support program, which you've also been connected, right? Because we have also been seeing a lot of big grantees, either they get a big grant and sort of they try to sustain themselves through multiple successive grants because they're not able to break that barrier and commercialize and go big. So what has been your experience with those guys, and any 1 or 2 illustrations on that?
Yeah, Madam, really BIRAC is giving a good encouragement for all the innovators. That encouragement, people are taking it in the right way. And especially these big grantees are getting mentorship. That I appreciate, and I always admire that they will not give only grant, but they wish to make it a successful enterprise. So that is the way how many biotech students or many entrepreneurs are taking it in the right way. But why these will fail? Like according to me, why these will not be successful? All 100%, why they will not be successful enterprise? Because one thing is the students, the entrepreneurs are not studied well. The market survey and all, they have not did well. Maybe with respect to small focus area, they are doing it, but over the time, maybe 1 or 2 years, the scenario will be something different. It has happened with us. Like one of our entrepreneur, he started making immediately at the COVID situation started in month of the April itself. He said, "Madam, we want to do some kit, like for a like what COVID kit, where we have to include the things which are required for everyone, like which they cannot do it immediately in the home. So such a very innovative idea, he got it. And I said, yes, we will do it. Let us go ahead. And then there, the complete lockdown was there, and we took the permission from the district DC and all. We started doing it. Then where he struck this, so he, whatever the idea he had, he started doing it. But the market survey he has not done, and economic survey he has not done. So where he could not make the kit affordable to everyone. This is the way how the startups are failed. He could not do it as an individual item. He could sell it, but not as a kit. But his idea was a kit. Ultimately, the kit has not come out, but two or three products have come out into the market. That's what mainly these entrepreneurs do it in hurry-burry, or immediately. I want to be first. That craze is there with these people. But what I suggest to them is, yes, proper study, especially the market survey is very, very important, where they cannot target only the local market. Yes, they have to target the global market first, then come to the Indian market, then local market. Always I suggest that. Yeah, this is the... Yes,
Dr. Bharti, that's the opposite. So
Yeah.
survey is quantitative and research is qualitative. If you start from the global and come down to India, you'll always find India is a very big market. But when you start from your neighborhood and start building it up, you'll find that there is no market. So it's always the other way around. They have to do a very primary market research to move up the ladder. The survey is an indicative of there is a hunch that there is something. But research is qualitative. So that's where you get to know whether your customer, one, is he willing to pay for something like this? And does he have an ability to pay for something like this? If he had done that research, he would have known that kit doesn't sell, but these 3 products sell, and still it would have been successful. So, I suggest that you tell them other way around, that please go and do the research first in the local area, and then try and, because COVID was a problem which is for 7 billion people in the world. If you solve a small problem of COVID also, you have a large market anyway. So that problem is in your neighborhood first.
Yes.
Yeah, I totally agree with Pankaj, because many of us actually fool us by looking at the large market canvases. That's not the way how it has to be done. It's like start small, dream big, start small.
Exactly.
Dream big, start small. The biggest advantage of non-metro cities, Bharti ma'am, and for all the audience who are listening, this is that they can try this out much faster. It's very difficult to get into entry to the giant rather than getting entry to, let's say, for example, Lakshmi was mentioning about the clinical trials. Tell me which hospital would say no to me if at all I'm going for a small town hospital. Whereas if I have to go to Apollo or something like that, I need to have a laundry list of permissions to get into that. So I think we need to have changed the perspective that rather than complaining what we don't have, knowing what is the strength of this ecosystem. And when I built Deshpande startups, I never actually changed a mindset. First, I only wanted to say that I only worked with 10 entrepreneurs to raise funds. Once the 10 raised, I mean, believe me, more than 40% of our entrepreneurs have raised grants across the countries. I mean, out of 210 startups whom I supported at that point when I was there, 40% of them have raised external funds. Can you believe? Show me one incubator accelerator who can claim that they've got 40% of their batch going into that. So I think we need to work it out reverse by doing a SWOT of the local ecosystems. What are the major strengths? When I did in Hubli, I was more working with the local ecosystem there, DC's office, HMDMC's office, get their buy-ins. The moments that we get their buy-ins, I think a lot of this will change. Many of things I feel rightly that we have been not mentored properly, or we have not been guided properly. Okay, and it's not, and failure is part of entrepreneurship. One should not get shy away in telling that I failed. I mean, I have no shy in saying that I failed multiple times. When people only know the success of
2 times, one time in US, $15 million down the drain, and I had to come back, pack my bags, come back to India looking for a job because it is. So imagine, and that too in the middle of my life, 35 years of my age. I went there, I did that, I came back, and then I started again. So what? I mean,
so entrepreneur, the audience who are listening to this, please understand that market is not always sexy and attractive. It is going to be tough ones. And your early adopters, you might find it in metro cities, but your large chunk of them audience out there. The whole purpose of me coming from I fondly come from a place called Raichur, which is one of the northern Karnataka district. In my wildest dream, I never thought that I'm going to be an entrepreneur. But it actually, when we get right customers, right mentors, I think we have got an opportunity, and that made me to go back to my roots to say that can we create it. And one other factor, what I'm also doing is to see that how do we unlock these markets. There are potentials. So don't assume that there's no markets. There are, even for a crucial bit, like for example, Bagalkot has a very fantastic hospitals. Hubli Dharwad has a very fantastic hospitals. The directors of the hospitals are accessible for a common person. It's not the case which is there in the metro cities.
Sure. Now, earlier on, Rajguru was also mentioning about startups starting something, then trying to implement it in the metros, because for any startup, sustenance, revenue, cash flow is the first concern. Then stabilize and then go back and serve the market actually needed. Because most of these solutions, the immediate need is in the rural India, non-metros, where it's really required. But you're not able to probably sell there, make money. So try it out in the metros. Again, as Patil was telling, trying out in the metros, probably talking to big global, big hospitals, where very difficult to make breakthrough. So I think it's a never-ending iterative process, right? Probably any of the panelists could take on this. So how to go about doing this?
Absolutely. You rightly said it's an iterative process and it needs to be strategic. You cannot have, one size fit all. You cannot do that. You need to take that call. A robotic or let's say if you're robotic arm surgery you are doing, you go to a small town and there will be a lot of skepticism. Plus there will be a lot of other issues, the electricity, this, that. So you need to start from this thing. So that's what we call, has to be a beachhead market. Beachhead was a Second World War term where America actually, when they went going into Japan, they started looking at islands which actually they could land, create a base, and then enter it. So that's what the entrepreneur needs to do. Find out a small market, figure out can you sell there, and if you can, then try and go and find similar markets. This is how a smart entrepreneur will do, and there are tools to do that. So it's an iterative process. There is no, it's not straitjacketed. You have to find, if Balakot has, good hospitals and you are biotechnology there, then you should. My just one submission after, and I'm not a biotech guy, but I am a technologist, so I can tell you, one thing that in next 3 to 5 years that you will see that will be common amongst everything will be the use of data, use of artificial intelligence, use of technology, and these two things will actually and that will come from rural areas. You see, so I'll give another example. There is a small startup in KIIT which is trying to detect early stage breast cancer through AI engine. Now we said, where are you going to get the data? He said, sir, there is on Andhra and Odisha border, there is a village where 90% women have breast cancer. I was shocked. I said, and? He said, sir, they just don't get anything out of it. They have to be transported here and there and there. He said, I'm getting all data from there. He said, the women, moment they go beyond 20, they start getting, it's something there which nobody knows. And then we connected. So KIIT also has a hospital. We connected to the hospital and we found that, so Google has a tool which says that they can do some, analysis on breast cancer. This was even earlier than that. They could actually now, in next, I think 12 months, they will be able to predict breast cancer at a very early stage where it can be taken care by oral chemo, not even the normal chemo. Oral chemo will be able to take care. So it's all linked. I think, so we need to focus in healthcare on data and AI. If we can do this, AI means all NLP, all that put together, the entire Jing Bang should be there. But that's where because there are two things we have in this country: enormous amount of data, enormous amount of people have problems, and if you collect that data, you will be able to get AI-based solutions for those problems very quickly. So bioinformatics is where I think the future of this country lies. And I was in Ministry of Information Technology yesterday with the senior team, JS and secretary and everybody, and this is what I told them. They're creating a huge AI platform but mainly that platform will be created for biotech. So I think that's where we need to focus on, and that's where the rural intelligence market may be, initial market may be urban, but has to then transpose itself into the rural market.
Sure. So if I may add a point, Lakshmi, on that,
Yeah,
the key would be the collaboration. I think what we are missing out today, collaboration is being said a lot, but practice less in the country. I'm very, very optimistic that in coming days it's going to be improving even further. I think we need to be, we shouldn't be shying away in asking for help. And I have seen some of this ecosystem, for some reason, for the baggage what they carry, they feel that they are big. I think entrepreneurship is a modest journey which will actually make us break our neck, kneel, everything to say that who the hell are you? So I think now is the right time. The key, when you said that, how do we solve whether this is the market or this is the market? I think we need to come find the midways. The real magic in India will happen only when the tops down and the bottoms up approach comes together. And there should be some gelling effect. I think a lot of these ecosystems are going to be played very crucial roles. Like, for example, like Pankaj himself on the call offered that he's willing to mentor. I'm pretty sure none in the Bagalkot or in the Woodpee region knew that we can actually chase Pankaj and then get him as a mentorship board. I think we need ecosystems have to come forward, show that, let's say, for example, if I were the CEO of one of these things, what I would do, I have got 10 MOUs of a hospital where one can do a clinical trials. Bharti ma'am, if you are able to openly produce this, I will guarantee you that 100 of the startups in healthcare sector will run to Bagalkot, irrespective of which place they come from. Because they don't have a facility for clinical trials. They don't have facilities for getting the certification. They don't have facilities for getting it. And I agree with Rajguru when he mentioned earlier, the paying price of a customer in non-metro is not vocal. Yes, I agree with you, Rajguru, because let us understand the simple math. In metros, we earn in crores, we spend in lakhs. In non-metros, we earn in lakhs and we spend in thousands. And in villages, we earn in thousands, how we spend in 100. So your product can't be one fit for all. You need to see that what all I can do with a small POC, how I can do it. Who are my early adopters, whom I can sell what? And this is what, if at all, how do I tailor-made it? And that is the reason why every other product company in the country has got variants of it. And healthcare product guys have to come to the market terms that they need to understand the market. And believe me, for clinical trials, for early adopters, I'm telling with all my knowledge, wisdom in place that the best place to try out is small towns. You're very easy to margin. And to maintain the business sustainability, you cannot say that only non-metro is my market. No, that's a fool thing. Because if you look at IT industry, for example, if I have to compare, tell me which IT industry grew like companies like Big is there, because they had a global customers paying them and local customers surviving them. That's something similar model has to be adopted by entrepreneurs who are solving the non-metro market, that they need to be optimistic, powerful, saying that this is going to be my last term market, but I need to see that where is my cash flow coming from. And if they're able to slightly balance these two things, I think that's where the innovations will happen. You cannot say that, okay, this is the only market, I'll not go out of this. I have seen some entrepreneurs from small towns, you won't believe that they wanted that production also to happen in small town. I said, why are you so worried about it? What if it happens in Bangalore and then you take it back to the, no, I won't. And see, we should not take too much heart for everything. The product, you go where the product can be perfectionist, then serve it out. So if we are able to carefully pricing it out in giving solutions, I think it will go further.
Yes, I just want to add one point here actually. So when we were working on our minimum viable product, so usually we will see what is the immediate available market, and based on the immediate available market, we will work with them to make our minimum viable product. See, one of the main thing we have to do for catering into the non-metro market is, while we're working on our minimum viable product, we need to work on our minimum viable pricing as well, which will works for the non-metro. It's not necessarily that all the features should be added in our first product itself. It can be some of the features, which is key functional features, can be added in our product, and that can be introduced into a non-metro market with a fraction of the price, or whatever the price which is adaptable and affordable for that market. That way we could able to get more traction for our business while we are starting our business in the first stage. See, when we introduced one of our automatic system, actually, we found that when we go and it's, as you rightly said, it's very difficult to get an appointment to meet a CEO of a multinational corporate hospitals. it requires like a lot of back officers to meet and to sit with the CEO actually. But if I have to meet a director or a CEO of a non-metro hospital, it's just in a next to one sitting, like we can meet them actually. So the accessibility is so high, but the price requirements is completely different. So if we understand our market and then tailor make our product to like fit that market requirement, then we can get yearly traction while starting our business itself with the help of non-metro market.
Thank you. Thank you. I think this conversation is so engrossing. We could go on and on and on. I think before we conclude, probably I would want one-liner from all of you. If given a magic wand for Indian healthcare startups, what would you like to wish for? Well, I think this panel, we have people with incubator background, incubator, startups, investors and all that, right? What would you wish for? I think we would probably start with Pankaj.
Yeah, I mean, I'm really very excited about biotech companies, and my wish is they really take help. I think Patil really said that incubators, accelerators, everybody needs to seek help. Their core is, so the two things. One is your core, which is understanding the technology, building, helping, the companies in doing what they do, what they know the best. But unfortunately, I have been to over 150 colleges, universities, and incubators in last 4 years. Small, anybody invited me, I just went there. Just wanted to understand how things are happening. And one thing I realized is there is no, there's zero understanding. And I'm saying this, please don't take it personally. Zero understanding of how to build business from an idea to investable business. Zero understanding. Not because it is not their job. It is their job is to help the core people with core skills to develop their product and services around that. But is that product required? Is there a customer who's able and willing to pay for it? That is really not understood in this country by anybody. I have seen IIMs absolutely academic. Everybody is there to give you gyan. They will tell you what to do. Nobody is there to tell you how to do it. And even if there is somebody who tell you how to do it, he is not ready to help you in doing how to do it.
Exactly.
And that's the irony of this situation. I have been banging my head against, Patil spoke about AIC, complete failure. I think they are just do nothing people. They just want numbers. Everybody is in numbers. So I think, but with you people here, including Rajgurus and entrepreneurs, seek help. Don't shy away from seeking help. Accepting that you don't know something is the starting of your learning period. And I would say, biotech guys, you have the future of this country in your hand. You can change not only the country, but the world, because we have the data and we have ability to understand the data, because IT is really matured phase. And the amalgamation of two will lead this country into something really, really beautiful.
Thank
So,
you.
if I have to just go next, Lakshmi. So I would more advice on entrepreneur is that what I got from one of my mentor, none other than Dr. Desh. He always used to say that any entrepreneurial company should have two categories of people. One is hunter category of the people and the farmer category of the people. What do I mean by that? So hunter category of the people are the one who are laser focused on the sales side, because if you look at typical hunting, they look at the prey, they are just not deviated by anything. They just are focused only on the target, and then they hit that right second, because if they meet at that split second, then they're gone. Okay, so you need to have that kind of guys. And there's another set of guys who are somebody from a farming category. What I mean by farming is they sow a seed, wait for everything for the environment, because they don't have anything in the control. They have to wait for the climate is not under control. Next pesticides, I don't know what I spray is not. So they have got that patience. And tell me very honestly, these two are very, very rare found to be in the same company. And the magic lies over there. I think as Rajguru, who's also the fellow panelist, who say that though he's not coming from a healthcare background, his founder is about a domain background, and he is bringing his engineering expertise to see how it can be scaled up. I think entrepreneurs should learn to make a peace with it. It is not my way, highway types, and don't go by only marquee entrepreneurs. Everybody has got one other. If you take example of Ulas, Bhavesh is one side, Ankit is one other side. Sachin was another side. So everybody has got this hunter and the farmer category, the people in the team. I think more, and these are diversified. So if I say A, they would say B. If I say not, they would say yes. The synergy among these two ends is the magic. I think if at all we know how to live with it, we should live it. And critics is good. Don't take it in a negative way. Everything is known for. I mean, entrepreneurs have primarily lost the ability to complain when they have chosen the business of entrepreneurship. The day I choose to be an entrepreneur, I think I've lost the power of complaining. If fundamentally all the entrepreneurs believes this, as Pankaj rightly said, India is the market for them. I think now the ecosystems are ripen up. They are coming to the stage. I firmly believe this decade is for entrepreneurs. And the whole reason why I moved from non-metro to metro is to say that I have seen non-metro for 5 years now, and I have seen the ability what we can actually do it. Now I'm more trying to see what and all connects I can give it for people like Bharati or Rajguru, that whoever are there in these metro cities whom I can pull you. I would love to be that conducive pipe, so say that now nobody can complain that I've not done anything over there, because I have seen there, been there, done that. Now I'm wanting to see that can I grow this thing for the exponential part of it. And that's where I think there are millions like me who are wanting to help these entrepreneurs. Please come together and then let's solve the problem of the country. I think that's where entrepreneurship is the way of life, is what I feel. We should all take a pledge to see that how can we make India a mecca of entrepreneurs, and particularly successful entrepreneurs who are solving the real world problems.
Fantastic.
Thank you.
Yeah. Bharti, over to you.
Yeah, my message to the startups is the hunger for success, forget about health, especially the healthcare startup. You might be engrossed with your startup, but don't work yourself to death for a bright entrepreneurial future. A wise man once said that health is wealth. But one thing we have to remember, or it is very clear, that society and poor people need affordable and quality treatment if possible. It is important to encourage our young and dynamic brains to come out with brilliant startup ideas. And I'm sure, like CM Patil, there are many people who are there to connect you all, or entrepreneurs. And like Pankaj sir, we have people who are ready to take this mentorship responsibilities. So it is a time for the young entrepreneurs, especially in healthcare, that you have to identify the mentors, you have to search, you have to rightly identify these mentors, and you have to approach the person who can connect you and all. And there are many government schemes are available, because money is the one which is required to make it possible. And you should identify, or you should entrepreneurs should get this money from a different schemes. There are many schemes, and of course, as Patil sir said, that this decade is entrepreneurs era. Surely we are noticing it in college, especially engineering college. The students now, students were asking what is about the campus and all, campus selection and all. But today, the same students and parents are asking, do you have an incubation center? Do you have an ecosystem to have the startup companies and all? Yeah, people are also changing, and Indians are aware about the scope of this entrepreneurship, and even government is identifying and putting a lot of money for the incubation centers, or to incubate, nourish, or strengthen them, all the entrepreneurs. So I wish all the healthcare entrepreneurs, people are with you, that you have to remember. Yes,
Thank
that's
you.
all.
Rajguru, over to you. I think you are the epicenter of the whole startup action ecosystem, right?
Yes.
Yeah, over to you.
Yeah, if I want to have a one wish for our healthcare ecosystem, that would be like we have to attain self-reliability in healthcare segment. India has to reach the self-reliability in healthcare segment in next 1 or 2 years. Like we have to have more indigenous products, drugs, and technology, with which we can serve the whole country with our own technology and own product. Actually, as far as my understanding, most of our health techs are dominated by like imported products in many of these segments, right from preventive technologies to right from diagnostic tools. Everything have a lot of reliability on the other countries. So I wish like most of our entrepreneurs will work on these segments and make our India more self-reliable in next few years. And coming back to the challenges, what we face as healthcare entrepreneurs, I just wanted to record some of the major challenges we have actually. Number one, see, there are two types of healthcare segments which is widely we can classify. One is on the core health tech, which requires a lot of certification process before we get into the market, and which requires a lot of trials, which requires a lot of help from the clinical trials, doctors, and different segments actually. And the other one is non-peripheral, it's a peripheral health tech, which is like allied product, which is not directly going to the health segment, but it can be used for the improvements of the health, like automatic systems, which is like helping the doctors. So all these non-peripheral health tech, both of these require different types of mentorship and different types of guidance, different types of support. So I wish, like, when you are formulating an incubating program, so we need to understand the product with which we are going to develop and what is the market we are going to do. And with that, if we develop a support system, that would be very much helpful for an entrepreneurs. Because we as an entrepreneur, when we enter as a health, startup, we are not aware of what is the real market looks like. We are it's a nightmare to take a product which is need client trials and other things. The normal life of a product in health tech is like say 3 years, 4 years to take it to the market, when compared with the other products, which is just 6-7 months they can take the product to the market. So health tech is one of the very unique area which requires a lot of trials, proof before we take it to the market. So the support system also should be developed, which should have all the strength to make your startup more successful. So if you understand all these support requirements and plan our incubation or guidance, mentorship accordingly, then we can achieve the self-reliability much soon.
Sure. Yeah. Thank you, Rajguru. I think I would probably assure you on behalf of the panel here that all your challenges would be addressed too, because a lot of optimism also came into when we all spoke, right?
Yes.
So I think I would conclude here. Thank you all so much. It was great talking to you all. Look forward to working together to build a very robust ecosystem and a very strong, vibrant India. Yeah. Thank you so much.
Thank you so much.
Thanks for having us.
Thank you so much.
Thank you so much.
On behalf of TechBharat, I thank all the panel members. This has been this will definitely be a gold mine of resources for any wannabe entrepreneur or an entrepreneur. I mean, there was so much discussed and so much perspectives. I'm sure it will help. It'll give a lot of guidance to the audience. Thank you so much. We wish you all the very best. Thank you so much.
Thank you.
Have a nice day. Thank you.
Bye-bye.
Have a nice day. Yeah. Thank you. Bye.
Thank you.